People are still connecting, so we can wait for another minute.
Yeah, I'm checking that they are entering in the room, right?
Exactly.
Maybe my light. Yeah, like that is better. Okay, hello everyone. Welcome to this first webinar by the EANS IM committee. I'm glad to introduce this webinar, not only because it's a very active committee and they prepare it with a lot of effort, also because I'm very happy that this is the first webinar in which the committee can directly approach the members and can show them that they are representing them in every meeting and they are working for them. The members of the society are the society itself, right? Because the members are the most important of the society. And even if for years we are taking care of them, now we are achieving one more goal, creating this channel in which we can directly offer some guidance and we can offer also some help, and we can listen the needs and explain them how they can pursue their career, they can find a pathway in the society. Let's say as a parliament of the members, we can open our arms and connect with them directly, offering the best out of the society. And I'm not gonna take longer. And we have two great neurosurgeons and persons, Rebecca and Marcus. They are both members of the committee, very active members, and they are gonna moderate this webinar. I hope the members enjoy it, and who is not connected today can enjoy it later. The recording, the panel of speakers they prepare is outstanding, and I hope the members can take a lot out of this webinar. Marcus, Rebecca, you can head on.
Thank you very much.
Thank you. Yeah, thank you, Marisa. So welcome, everyone. We're really excited to have you join us for today's webinar, Getting Involved in the EANS, Personal Experiences and Opportunities. So whether you're a longtime member or new to the EANS, this session is designed to help you to explore ways to actively engage and to contribute to our community. So while we're having this webinar, we've experienced that many people are actually wondering how to take the next step within the EANS. So maybe you're eager to participate in research, in the training courses, or the committees, but you don't really know where to begin. Or perhaps you also see the EANS as a network that can feel a bit closed off for some of you, and you're looking for a way in. So today we will try to give you firsthand experience from members who have successfully navigated their journey and their careers within the EANS. So they'll share their personal insights, the practical advice, and also concrete opportunities to help you find your place in the organization, whether it's through the leadership, through education, research, or just networking. What we want to do, we want to really encourage your active participation throughout this session. So this is your opportunity to connect with experienced professionals and gain valuable insights. There is a QA box that you can use to send in questions, and we will try to answer your questions during, not during the session, but in the end of the session when we have the roundtable discussion. If we do not have the opportunity to answer all of the questions, every question will be answered by email later on. So don't worry about that. So thanks again, and Rebecca will introduce the roundtable and the first speaker. Thanks.
Thank you very much. Thank you, all of you, for being here with us today. And I would like to introduce the members of the roundtable at the beginning of this webinar. We're very excited to have them with us and to have our speakers. And thank you, Marisa, for being so involved with this plan that we have right now. The roundtable is going to be composed for three panelists. The first one is Andreas Demetriades. He is neurosurgeon and spinal surgeon in New Royal Infirmary in Edinburgh. His clinical and research interests are aligned in spine surgery outcomes, but also in neuralgia of trigeminal neuralgia, trauma, neuro-oncology. And he's the author of several scientific publications, more than 200 if you look for him in PubMed. And he is the immediate past president of our society and the actual vice president of the Global Neuro Foundation. The second person is Vicky Butenschen. She's a neurosurgical consultant in Munich. She's Master of Science in Health Economics in Oxford and Heidelberg. She's also author of several publications. Her main area of interest is skull base and spinal tumors. And she is one of the delegates of our committee, the Individual Membership Committee, and also part of the Global Humanitarian Committee. And the third person is Fabio Torregosa. He is resident in neurosurgery in Palermo, but he's currently doing his fellowship in cerebrovascular neurosurgery in Lisbon with Professor Coteiro. And he's also author of several publications focusing neurovascular, skull base, but also trauma and spine. And he is an important part of the EANS Young Neurosurgeons Committee. For the speaker, the first speaker is Claudius Tomé. He will talk about a journey of 15 years, reflections and insight from a committee EANS leader. He's a full professor and chairman of the Department of Neurosurgery in the Medical University Innsbruck in Austria. He also has hundreds of papers in PubMed, more than 300. And he has been the EANS board member acting as a chair of a scientific liaison. He's part of the training committee and he has served as faculty in the organization of a large amount of training courses, especially in spine. And beside the EANS, he has served as president of the Austrian Society of Neurosurgery and the Austrian Spine Society and the Austrian Society of Surgery. So I think there's no better person to talk about this topic. And Claudius, whenever you're ready, please.
Oh, thank you, Rebecca. I'm going to share my screen. Well, thanks a lot for having me. I think this is something very special because obviously normally we are used to have talks on topics and that generates interest in our members. But this is a very different topic, and I would like to ask to thank the whole IM committee, Marisa, obviously Rebecca, for the introduction, that we have this. I think we should go that way, that we get to find ways to involve our members more, because we are asked all the time, as Marcus already alluded to, how can you get involved in the EANS? And so I was asked to talk about my journey in the EANS, to give some personal reflections. And as a kickoff, I'll try to be brief. Obviously, I could talk for hours about the EANS, but I'll try to be as short as possible. So actually, many people don't know, I've never been a trainee in the training courses. My boss then decided that I was too good by the time I would have achieved a spot in my, I think, 4th or 5th year of residency. So he said, no, you don't go. And he was actually the delegate who was deciding on this. So I was not involved back then. But then how was I invited? How did I get involved? Obviously, I was always interested. And my first faculty position in the training course was for spine in Trondheim 2008. So actually, to my surprise, it's a 17-year-old journey now already. And how did I get involved? I got involved by having published a few papers on randomized controlled trials on spine. Nothing too fancy, very, very easy questions, actually. And this raised interest in the training committee, and they invited me to give a talk about these presentations and about those evidence-based surgery topics. And then I was invited to further courses and ended up being more and more involved, giving presentations, and managed to be nominated as a training committee delegate for Austria. So that kind of got me into. So I really went through the training course channel, if you will, and I guess Martin is going to talk about this later. From then on, what about my positions? Well, obviously, I told you about the TC delegate position. And then I was faculty at advanced spine courses, altogether almost 20 courses now over the years. I did organize a young neurosurgeons meeting, advanced spine course in Innsbruck. Also something that I would encourage those people out there to do. It's a lot of work, but this really puts you into the society. If you go through the work and do a course, advanced course, or young neurosurgeons meeting at your home base, and this will also get you more well known in the community. Then I ended up, after more than 20 training courses that I attended as faculty, I was happy to be elected as training committee chair, and thereafter, as Rebecca already said, as a scientific liaison chair. So I've had a number of positions and was present on the board. So it's also an evolution of a time that if you put a lot of effort into it, to stay inside. So what's the important aspect of how to get involved? Well, first of all, you have to have something to offer, be it something that you have published, something that you are very good at, that you want to put in. And the second thing is you have to tell people about it. I'll talk about this a little later in a minute. You have to be ready to put in time, dedication, and commitment, and then you can follow the path to really be more active within the EANS. And there are many options. I just briefly talked about, even though I didn't go through those, but I know many people that have went through those channels. You can go through the sections. We'll talk about this later, so I'm just going to be brief. So basically, if you're subspecialized in a certain area, go into the sections, try to make your way there. And also the committees, particularly Young Neurosurgeons Committee, is probably the easiest option, because most EANS members or young people ask me how to get involved after the training courses. They're really eager after the training courses to stay involved, and then they don't find the way to go in. So the Young Neurosurgeons Committee is probably the best way to get involved, because they're very open to take on. The more difficulty I see is that if you are not putting enough time into it, it may be difficult. And when you are young attending, you have a lot of things to do. You may even have other private stuff, of course, to take care of. So this is difficult. And also training committee, I guess Martin is going to talk about it, but I know a number of people that have gone through the TC delegate of their national society, asking them, because the local people in your nation, they usually know you're good at vascular or you have done research in tumors. And this is a good way to get involved, to become faculty. And then obviously you have to perform. And even trainees that have given trainee lectures and shown that they've done great research. This is something that I find a little bit underrepresented at the training courses, that people don't really think that much about how important a training lecture can be. That can also be a way to get involved into it. And obviously you can go for a board position that usually doesn't work if you haven't been involved before. This is more after a while. So the basic questions you have to ask yourself when you want to get involved, according to my experience: what are you interested in? Do you want to do teaching? Do you want to do research? Or do you want to just be active in society? Some people are very good at administration and doing society work. And then also, hopefully you're not only interested in it, hopefully also good at it, which makes it important that you put something in. How much are you willing to put in? Because it is effort. It takes some frustration if you don't get to the positions you want to. But you have to be willing to put something in there. And my general advice, and then I'm already at the end pretty much, is I'm always telling everybody, get a label. If you're known for something, you're good at something, and usually this goes via research and publications, because that's the way our system in medicine works. then you can get involved in the society, in the sections, and also potentially in the training course. Choose a mentor, ask somebody, and ideally that's somebody from your home country. Obviously, this is not, can't judge whether it's easy or difficult, but ask your national TC delegate, oh, I'm really interested in being a faculty in training courses. I'm good at this. I'm happy to take something over. Also, section chairs, committee members will be able to support you. And grasp opportunities. When you're asked to be involved in something, most people want to have the attractive positions. They want to talk about very fancy things. Don't. Ask whether you can talk about normal pressure hydrocephalus. Nobody wants to talk about normal pressure hydrocephalus. And if you say, okay, I will put something in there, these are ways to get involved. Be available short time, because in many courses, faculty is needed because people have to cancel, and try to keep in touch with some people that are in charge there. This is basically my advice. And be dedicated. I think it's worth it. It's a great society, the best out there, if you ask me. And I think we can even improve it further with a lot of young people getting involved. So thank you very much. I hope we have a little discussion at the end. I apologize that people are running around because I'm in a hotel lobby here. I hope you don't hear that too much. And I'm happy to join in the discussion later on. Thanks so much.
Thank you very much, Claudius.
Thanks. Perfect. So the next speaker is Radek Fritsch. He's a dear colleague and friend and senior consultant at Oslo University Hospital, our neurosurgical department. And he is the chair of the EANS section of pediatric neurosurgery, but he's also a long-standing member of the individual member committee. So he has also a lot of experience in the EANS society, and he'll give you some advice regarding the sections. So thanks, Radek, for being here and joining your information and your advice.
Okay, thank you, Marcus. Just trying to share my screen. Can you see it now?
Perfect. Yeah, we can see it perfectly. Absolutely.
Okay. Well, thank you for a nice introduction, and thank to Claudius, because he told you actually very much of what I wanted to say as advice to our younger colleagues. So my idea is actually just to very short introduction about how the sections within EANS work and should work, and how you can get involved with them. So just to mention my personal record, because it's also a kind of inspiration similar to Claudius. I actually went all these courses, and it was kind of eye-opener for me, because it really confronted me with the level of European neurosurgery at that point of time. And I made a lot of friends, which I still meet in congresses, and I would definitely recommend to take these courses if it fits in your career. It really was a game changer for me. So after a short while, when I was finished with these courses and I started to follow EANS activities, I actually became a member of individual member for very many years ago, and I realized that at least since 2008, I actually attended all congresses, all meetings. At that time, we still have so-called winter meetings. And since 2014, I guess it's been congresses every single year. So I've been there for every time, and I think I might say that this is the most worthwhile congresses. I've been also to American congresses, but still think that our European congresses are the best ones. So my next way was, being a Norwegian delegate to EANS and the annual general meeting. I was a member of individual member committee just until the last year, and it really gave me a lot of pleasure to meet these colleagues again and to be able to be involved in new projects. And especially in this exciting period of COVID, we had an idea of webinars, which was very well effectuated, and this is something which is going to stay there for future. I'm very happy for that. And I was also there when Marianne Euler approached some of us and asked us to be founding members of what was supposed to become a section of pediatric neurosurgery, which actually didn't have any tradition in EANS. And that's mostly because there are dedicated societies of pediatric neurosurgery, both at the European and international level. So this was something new and exciting. And I guess since 2019, we've officially had this section. And I've been a member of the section panel. And at the end, I was asked to take over after Sergei Goleshev, and it's my current position. So this is just an example how the way can go since you get involved in EANS. And as you know, EANS is originally meant to be an association of neurosurgery societies. Now the more and more important part of it is the individual membership, and the sections. Indeed, we currently have 10 sections, are meant to be there to coordinate, the work and activities within the specific areas of neurosurgery, and we also obliged to communicate with each other, to interact, to have a common projects, joint projects, and it's really exciting part of this work. So how it works? I mean, every section obviously has a chair, which is elected by the annual general meeting for 2 years, but you can be re-elected once. Then, as a chair, you can actually pick up some members of your section panel, maximum 15 people that can help you. These can be chosen by your likings, but at the same time, you should have representatives from different countries, east of Europe, north of Europe, south of Europe, or whatever. And you should also be including the different expertise within the specific field of neurosurgery. But the most important part, of course, are these sections members. That's you, if you choose to be a member of a section, and that's why we do it. So I regard my personal task in this to be a coordinator, the one who communicates with people, or if it's necessary to represent the section. Our section panel members are supposed to work as an advisory board and be my close collaborators when we do a work, because there's a lot of work for these people, as I will explain you shortly. But we do it mostly for you, so we attract members to these sections, and that we coordinate together, activities that can lead to something, some outputs. So just an example, my current panel is really people representing the widespread of European neurosurgery. What we do is, of course, we are responsible for putting together a scientific program of EANS courses, but mainly congresses. We are supposed to organize at least 3-4 webinars a year. So we need to have a plan for a scientific program of these congresses, because we cannot just repeat the topics, every single year. We need to have a master plan for many years ahead. So it's a teamwork, and we can organize the surveys. It's a very nice thing. We can organize work leading to guidelines, recommendations, and put together some publications. And it's been really done a lot of it. Some sections also organize section meetings, which I think is not a common thing, but at least vascular section, and I guess also spine section has regular meetings, because these are big sections, while some other sections like radiosurgery or pediatric are a little bit smaller, of course. So this is just an example. I could put here many more examples from for example, brain and spine, consensus, recommendations, guidelines work from different sections. It's a very effective way how to get a thing published, because if you have a lot of collaborators, if you work close together, if you have good idea, this is how you can get involved in really good stuff. So I think it's also very important to have a good communication with our members. So different sections, different ways of communication. In our section, we have a LinkedIn group, so the members can actually approach us to come up with ideas, and it's very much that's very welcome, because the way how can I give us is quite easy. Obviously, you need to be an individual member of EANS. That's the first thing, but it's really beneficial, and I would absolutely recommend, if you're not an individual member, to become one, because the benefits now are just many, and there are many more to come, I guess. Then if you choose that there is a specific area of interest, you can be a member of a section. It doesn't cost so much extra, and then you're already involved. And in different sections, maybe different way how to approach, but I think the easiest way, as Claudius also told us, is to contact the section chair, panel members. I mean, we should be close together in EANS, and it should not be any big problem to approach someone who can offer you some closer collaboration if you're interested. So, you know, the typical and optimal idea is the way is, okay, if you have an idea for a collaborative project and you feel they would benefit from, you know, speaking with someone about it, to put together, for example, a survey or multi-centric study. I think the EANS sections are a very nice platform. So if you have an idea, you should actually just prepare the project, come to our section meetings, contact the chair, contact the panel members or your national delegate, and we can see what we can do together about it. So just to wrap up very simply, I mean, if you sign in, if you contact us, if you join us, you already get involved, because after all, these sections are there for you. So, you know, it's easy to find contact to every chair, and I think everyone will be happy. And I actually wrote an email to all section chairs last week, asked them for you know, for ideas for this webinar, what they want me to communicate, because I'm speaking a little bit on behalf of all them. But the unisono answer was, well, just give these people my email, and we will be happy to welcome them and include in our activities. So just go ahead.
Thank you, Radek. Thank you very much. I think this was really insightful. So, Rebecca.
Thank you very much. The next speaker is Martin Lejeca. He's going to talk about the EANS training courses. Professor Lejeca is head of section of vascular and skull-based program in Helsinki. His research is focused on cerebrovascular disease and brain tumors, but also in mechanisms of learning and microsurgical techniques. And he has remained very active in our society for a long time, but nowadays he is one of the EANS board members, acting as chair of the training committee. So, Martin, whenever you're ready.
Thank you, Rebecca. Thank you very much for the invitation. Now, what I thought that I will start by introducing a little bit the training courses, and then I will talk a little bit how the whole system works. So I've been the chair of the training committee for the past 2 years. My term will finish at the end of this year. So then we will, after that, have a Pablo, who's from Spain. He's going to be the one succeeding me. Probably many of you have actually attended the courses, or at least you know what the EANS training courses are. But I mean, just a sort of short reminder. The whole idea of the EANS training courses, or the aims, first of all, is the improvement of the neurosurgical education in Europe. And the second is networking with peers. And I would actually put quite a lot of emphasis on the second one, because I mean, these are usually the relationship that you build during the training courses that last with you then for decades from then on. It's a 4-year program for neurosurgery residents. So it's usually residents who started. Some of them are already have finished their residency by the time they do the last course, but usually it's somewhere around the 3rd year that most start the course. We have 4 topics: tumor, vascular spine, and then the last one, which is functional trauma and peripheral nerve. They rotate, and we have 3 rotations. So it means that we run the course 3 times a year, and these topics, they circulate. Each of the courses has usually around 230 participants nowadays. How to get on the course? Well, the way how it works is that each of the national societies of the EANS, they have a limited number of places on the course, and the number of places is based on how many members the society has told EANS they have. So each of the societies, they sort of pay a fee based on their number of members, and that is then calculated into these quotas. When you apply to your national delegate, The national delegates, they have different system in each country, depending a little bit on the number of applications and the ways how it's done in a particular country. But what they do, they rank the applicants, and then the ranking list is sent to the EANS office. And whenever there are vacant course places for the particular country, so they take people from the list. When you accept the place for the course, it means that you actually get admission for the full 4 years. And it's also expected that you finish the course. At the end of the course, well, after the 4 years, so people participate in the first part of the exam, or fancy name is European Board Examination in Neurological Surgery. This is the electronic part, and that's sort of like part of the course. And then you get the diploma for completing the training course program. That's after your 4th course. Then there's an optional thing, and actually these examinations, they are not completely dedicated to the course themselves, but I mean, you can do them separately if you want as well. But then it's the option of doing the part 2 of the core of the exam, which is oral, and I would say that a limited number of people only do that. But those who pass also the second part, so they become the fellows of the European Board of Neurosurgical Surgery, and they can use this acronym FEBNS after their name if they want. This is just an example of what nowadays the course programs look, because I mean there has been some evolvement over the years, how we have shifted from certain types of teaching to others. So what we do nowadays is that there's about 1/4 of the program are lectures. They are the ones which are in gray. So that's usually in the mornings. And then the rest of the program, that is interactive teaching. So we have either discussion groups or different breakout sessions. But anyway, we try to focus on the interaction, because there's really no point in traveling across the Europe just to sit in a lecture room quietly and listen to one person to speak. So this is the trend that we have been trying to follow. And I think that we've been quite successful, but at least based on the feedback we have gotten. So then how does the course program, how is it built up? The way how it works is that the training committee chair, at the moment me, but before me, for example, Claudius or Vakis, he or she is responsible for the scientific program of the course. So they take up on the task of planning the whole course program, and it's actually quite heavy when you have to do it three times a year. So like I would have to say that the 2-year period is quite enough that you want to do it. The EANS office team, they take care of the organizational issue related to the venue and to the social program. And as their help, they usually have a local host of the particular venue, because we go from one city to another, from one country to another. And the part of the local host is very important to bring in the local flavor of that particular course. So although our office people are excellent in negotiating with the different venues and everything, but still it usually is much helpful if somebody from the particular city can provide us proper contacts. The educational content, the teaching strategies, and the aims of the particular course, they are discussed at our training committee meetings. During the courses, we have a meeting every day during the courses, and there we go through like both short-term as long-term aims, and try to figure out in which direction we want to move the course. Then for some courses, we then also have a discussion with the EANS sections, so especially the section chairs, whenever that we feel that is necessary. This is very much dependent on the expertise of the particular training course chair, as well as the composition of the training committee, because depending on the situation, we might have more experts in particular fields and lack experts in other fields. So this is why for some courses we involve the sections more and for others less. Then one thing that people usually ask for is who are the teachers at the courses? Majority of the teachers are national delegates to the training committee. There's one delegate per society, per member society, so per country. And these are appointed by the national societies. So EANS as such is not the instance which is nominating them. It's actually the national societies who decide whom they want to be the delegate for the training committee. And these people, they form the backbone of the teachers, and they are usually about, I would say, 60 to 70% of the teachers at a particular course, probably closer to 70. Then we have some of the board members and also some of the section panel members. It may be the section chairs or then other panel members. The distribution and number of these people depend a little bit on the topic which is being covered. So for certain specific topics where we don't have the expertise inside the training committee itself, then we have to ask for specific people then to join us for the courses. And then the much smaller group are some people who are really experts in a particular area. And there, I would say that the emphasis is mainly on the educational skills. So it's not enough that you are really good at doing something, but you also have to be very good at delivering the message. Because the point is, the training courses, they are considered to be the basic educational courses. So in a way, an experienced neurosurgeon can probably cover very many of the topics. But here and there are kind of instances where we want to have a particular expert in the field and delivering the message. But I mean, it wouldn't make sense to have that for everything. And we really try to keep the courses relevant to the time. So this is not like an advanced course. And that's probably important to keep in mind as well. Then a few words about the national delegates. We have been working on EANS recommendations for the societies. As I said, each society can decide whomever they think is appropriate for the national delegate. But I mean, there are some attributes that jointly we have been discussed at our board meetings, and we have put them to paper. Also, because the thing is that the national delegates, they are ambassadors of that particular society among the future young neurosurgeons. So what we think are the traits they should have: they should be good teachers or trainers. They definitely should be interested in modern teaching methods. They have to have the time to commit to the training committee work and to the courses. They should be experts in at least one of the fields of the neurosurgery. Of course, they can be more than one, but at least one should be their really strong side. They should be interested in the course concept as such and understand what we are trying to achieve with it. And they preferably should be from an academic institution, because after all, I mean, this is really educational content. Then just maybe like everybody else already mentioned how they ended up in the position that they were. So for me, I did the training courses about 20 years ago. That was my first experience with EANS as such. And I think for many members, that is the same way. After that, exactly as Claudio said, you have to become expert or let's say known for something. I, at that time, was doing very heavily vascular neurosurgery. And so at one point I was invited to be a faculty member at one of the vascular courses. And after that, I was lucky enough that at relatively young age, I was chosen as the national delegate from Finland. So then I started attending the courses, and by that I developed contacts and stayed on as a faculty for extensive time, partially because of my fields of interest and especially my interest in teaching as such. So that was how I ended up with doing it. I can really recommend participating in the EANS, but I must say that the training committee is not probably the easiest way to get into, because it's really so much involved, or it's composed so much from the national delegates, and it varies from country to country how much politics it is involved in becoming the delegate. So, but if you are really interested, especially in teaching, I think this is where I would try to aim that in the future you might reach this goal. Thank you.
Thank you. Thank you very much, Martin, for your talk. Very, very clear, all the information. So I think there are a lot of people who right now know how to get in. So again, thank you very much, Martin.
Thanks.
Okay, so the last speaker is Catherine Rabier. She will talk about how to get involved in the research part in the EANS. She's a senior consultant practicing at the Art Clinic Hospital in Sweden. She's the former chair of the spine section at the NU Hospital Group in Sweden. And she's done her neurosurgical training at Sahlgrenska in Sweden, also a fellowship in Australia. So currently she's chair of the EANS Research Committee. And most importantly, she's a very inspiring vita. So if you have a chance to read that, that's really inspiring. So do that. Please go ahead, Catherine, and give us some information about the research topic.
So thank you so much for the kind introduction, Marcus. And I want to thank Marisa and Rebecca and yourself for the invitation. I really appreciate it. So how to get involved in research? I think that Professor Tomei put it out very well. The first thing you need is a genuine research interest. And the second thing you need, which is equally important, sometimes even more important, is to talk about it and talk to others and form contacts with others. So for myself, this is how it started. One thing led to another thing. And as a senior resident, I also did not do the EANS research, the EANS training courses, but I heard about EANS and I thought, okay, this is a great way I can submit my research here and present it. So this on the right side, what you see is the first oral poster that I presented at EANS. I think it was 2014. And that's how I started. I started submitting abstracts to congresses, going there and making oral presentations. Of course, naturally, you come in contact with others, you talk to others, and then I became a member as well and was looking at opportunities that EANS has to offer. And there are a lot of opportunities. One thing that EANS offers that I don't know if you know about is observerships, fellowships. So I did a spine fellowship through EANS in Leiden and Hague. And then I saw that, oh, there is an opportunity called ESCALIP Award. So I'll talk about it a little bit later. But I applied the first time and I didn't win or anything. But the second time I applied, I won the ESCALIP Award, the clinical award. And that led me to sort of come in contact with the EANS Research Committee. So after that, I talked to an EANS office. This was not, of course, from day one to the second, but you know, it's a process. And then I talked to Dr. Rolla, who was the chair of the research committee. And then after a while, I went to the EANS research course and joined the research committee. So what the EANS research committee does is we organize a research course every year. We evaluate the ESCALIP Award, and we participate in evaluation of the EANS Research Fund applications. I'm going to talk a little bit about those things because those are really important opportunities that EANS offers young researchers, and I think everybody should grasp those opportunities and apply for those things. So the research course, I would say, is an excellent opportunity to learn about basics of research, how you present your work, preclinical research, clinical research, research methodology, that sort of thing. And what we do during the research courses is that we also offer interactive sessions. So here you're looking at an interactive session at the recent course, which was in Hamburg, where the trainees get to present their ideas, present how they would want to shape a study, for example. And then you see that we have faculty sitting and commenting. So you have experienced researchers and experienced faculty who can comment and you can interact with them in a much more private, I would say, environment than what the Congress is. So it's a very good opportunity to also meet other trainees who are research interested and maybe form collaborations with them, because I think that would be great for the future of our society and also for the European neurosurgery in itself. We are currently doing a new course concept, and we tried it first in Hamburg. It was very successful. Here you see some of the participants and faculty. And I saw that Dr. Suero was on the call here. He helped us. He did a fellowship in computational neurosurgery. So he helped us talk about fundamentals of AI. And then we had about implementation of AI into your research. How do you do that? We have a collaboration set up with Ethical Legal Committee, and we have people from Ethical Legal Committee giving talks about research ethics. And then at the end, we have finalists for the ESCALEP Award coming and presenting their work. And this is always really impressive even for the faculty. Every year they say, wow, this was amazing. Like, how can there be such a high level of presentation? So this is a way of highlighting your work. And then we also held a research symposium in Sofia that was very well attended. And we also hold a parallel session during EANS congresses for research. And again, these are venues where we can have room for a little bit longer lectures, more in depth in the symposium that we held. And also you have time, and you can contact people who are talking. It's not like 10 people, it's 4 or 5 people that are selected, and these are experienced researchers, and you can go afterwards and talk to them. They're very approachable people. So again, another chance to complement the research course, but also for you to interact with researchers and with myself as well, if you would like to, and get involved. Another opportunity I wanted to highlight that exists through EANS is the ESCALEP Award, and this, together with the EANS Research Fund, are offered to young researchers, young neurosurgeons. We offer 1 award in clinical research and 1 in laboratory research. And out of the applicants, we get a lot of applications. Out of the applicants, there are 3 finalists in each category, and those finalists are invited to come to the research course and present their work there. And I really encourage people to actually come there. It's a great opportunity, but also it's a completely different thing to be there and present your work and interact with everyone else than to sit on Zoom and present your work. And then the nominees, of course, present their work there, and the successful person gets €5,000 and gets the award at the Congress. Another opportunity, the deadline hasn't passed, and if you have interest to submit the work and you haven't worked on any application, just let us know. And I talked to Niklas Marklund, who is the person for the EANS Research Fund, and he said he could also accept applications if they were submitted during the weekend. So this is seed grant for pilot data. So if you want to start research, you have a project and you want a seed grant, you can get €10,000 from EANS, and it covers all areas of neurosurgery, again, directed towards young neurosurgeons to get them started. So this is an amazing opportunity that I think everybody should grasp, and then you get to present again your work and what you have done afterwards at the EANS conference. The evaluation for this is based on mainly scientific content, rational methodology, feasibility. We are not looking for, a grand project, but something that is a seed startup project, and you have a clear plan, you know where you're going, and it's feasible with €10,000. So you're not describing a mega project and then saying, oh, €10,000 is going to cover it. So just that is enough in itself. And I would say the best way of not getting any grant for your work is to not apply. So just sending an application is really important. If you're not successful the first time, the second time, I'm sure you're successful. Some future perspectives. for us. I know that not every trainee trains at a university hospital. Every year I get approached by people who are not at university centers and ask, oh, how can I get involved in research? So we were hoping to create a research fellowship directory and perhaps also a research fellowship. Currently working on funding for that. If that would happen, then that means a bigger opportunity again for our members, for young researchers. And then I know that we within EANS are also working on setting up research that is led by EANS itself, and that again would benefit our European society, our European neurosurgery, but most importantly, our patients. And with that, I want to invite you all to Sicily, where we are holding the research course and the Young Neurosurgeons meeting. And this is, again, an important and great way to interact with others, to hear about others' research, and to present your work. Thank you so much.
Thank you, Catherine. I think this was really inspiring, absolutely, for young people to get involved. It's an easy way and it's really worthwhile. So thank you very much. So Rebecca, I think we'll turn over to the roundtable.
Thank you, Catherine, for your talk. Amazing. Now we need to go through the roundtable sections, but I would like to thank all the speakers because you have been very clear. You have attached to the plan that we have for this webinar. So really thank you very much and congratulations for your talk. And now we move to the roundtable and we look for the questions that the people have make through the web page that we have open for the assistant could make their own question before the meeting. And one of the questions that we found that is quite interesting, maybe Vicky, could you answer this one? He said, I just finished my EANS training course and I'm motivated to jump into being actively involved in EANS courses, meeting committees. How do I start?
So I think Claudius already mentioned it in his presentation. I think the best way, if you're just finishing the training courses, is to stick with the Young Neurosurgeons Committee or to be part of the Congress also, because it kind of follows the training courses and it has this age aspect. So people are in their beginning of 30s. Everyone is quite the same age. They try to put up research together. They try to build up networks. So I think the Young Neurosurgeons is definitely the right address to continue to stay into the EANS.
Thank you very much, Vicky. Yeah, I think it's important to be, to create the networking. Catherine was saying that maybe sending abstracts to the congresses and everything is the way that people knows you. That's the way you go to the congress. That's the way you get the network. Also, yeah, I think it's not also only going through the training courses. I mean, there's other ways too. It's but for sure, being in touch with the people is your age, as Vicky is saying. I think for sure is a good start.
Perfect. There is another interesting question actually that came in here that says, can you comment on any opportunities you see for international collaboration? So probably meaning also beyond EANS. So collaboration, is that research-wise? Is that for other things? Anyone who wants to give some comments on that? Maybe Andreas, what do you think about opportunities for international collaboration?
Thank you, Marcus. I saw that question and it's a very good question because it comes from someone we respect very well, and it's great to see you, Michael, Michael Failings following our activities. There are several opportunities and they are growing. The first one is educational. The EANS courses, which have been now running for almost 55 years, have been very successful in creating a community spirit throughout our continent. but also maintaining high standards of education and congress in clinical research. Therefore, we have tried to partner with other continental societies in delivering such courses. We have delivered such courses in the Middle East in the past. We have delivered one in Latin America, and we have also delivered one last year in sub-Saharan Africa, with another one being planned this May 2025. So there are plenty of opportunities for education and collaboration with colleagues from other continental societies. But the other important aspect is clinical research. And I think in the horizon, I foresee an increasing amount of activity from a clinical research point of view, because we have set up the EANS Foundation, which is a new clinical entity. It's headed currently by our past president, past president, Carl Schaller. And we are at the early stages of raising, of fundraising, and therefore also raising awareness. I think this will supplement very well the EANS parent societies research efforts, so that we can hopefully address clinically important questions in the future, because a lot of our work is on relatively small populations, and we have to have international collaboration.
Thank you, Andreas.
Yeah. What do you, Claudius, think about this? Claudius?
Well, I think obviously it's great, and people like Michael Felix obviously are a perfect example for that, because they come to our meetings, they get involved with our European groups, but it also depends a lot on the international collaborators, and I think he's the example that works very well. I think it's more difficult to get involved others, but it's a good idea to reach out there. Personally, I think it's great to have those international collaborations. I would like to be more focused on trying to get the EANS people, the Europeans that want to be involved in the EANS, to get involved. I think this should be our primary goal now, and then we could use people like Michael to also get international people joining us more. And this is something that we can probably discuss with him personally. It would be a great idea.
Okay, thank you very much. Any other thought about this question? Okay, so there's another question. What are some common misconceptions about joining and contributing to EANS, and how can we address them? Someone wants to answer, maybe Martin? What are some common misconceptions about joining and contributing to EANS, and how can we address them?
So, I think misconception, yeah, sorry, but misconception could be that people think it's difficult to get involved in things. There is hesitancy and so on. So I think that's the background for the question.
Yeah.
And also, maybe if I can comment, I think one of the problems is that some people complain that we are a group of friends and everything, which I don't think shouldn't be seen in a bad way, because I think that's the beauty of our society, that it's not only collaboration, scientific work together, it's also friendship, but we should try not to leave people out. Maybe that's what they mean, that they have a hard time getting in. But I think many of them are, I don't know, too shy or don't know how to address us. And most of the people involved in EANS, I think the section chairs, you name it, Katrin from the research committee, you can contact. They will not have a problem. They will not say, "Oh, you're not my friend. I don't know you well." And it just depends on, you also have to show some dedication to get involved. So I don't see this as I hear it as a negative connotation, but I don't see it in a negative way, to be honest.
Thanks, Claudius.
Okay.
Because there was another question, which is basically a little bit similar. How can ENS become more inclusive and accessible to people also from different backgrounds and experience levels? Maybe Martin also wants to say something. Because
I think Radek wanna say something, right?
Yeah, sorry,
Radek?
Radek.
Yeah, I just want to, to support Claudius' reply, because it's also one of the responsibilities of section chairs, for example, when we put together a program for the Congress, like we do now. So it's important not only to have, the prominent names for invited talks. It's actually, and many of my section panel members actually have commented on this and proposed, people they know, they are a little bit younger. We don't know the names yet, but these people have done some research. The people already started very successfully their careers. And it's very important that we include them in the program and we give them a push. I mean, if you've done a lot of research on this topic and we actually have a session on this topic, well, why don't you invite you, even and probably not everyone knows your name now, but in 5 years, you will be a renowned expert. So it's also one of the opportunities how to actually follow what is going on, also in next generation, and to give these people a push when they need it, as I feel it.
Thank you. Catherine has also risen her hand. Please, Catherine.
So just to, again, the point that was raised by both Claudius and Radek, to reiterate that again, is that we are approachable. A lot of the members of the research committee got involved by just coming up and saying, hey, I want to be involved in this. How can I get involved? I'm willing to do work in the research committee. And then we talk about what kind of work we are doing and if it would interest them. So we're avoiding this, that one person goes away from the committee and then gives his seat to another person that they have chosen, but rather we want to have people who really are interested in the committee's work. So if you are on this webinar and you're interested in research committee, please contact me and I'm more than happy to include you.
So yeah, I mean,
can I say something? So the goal of this webinar is exactly that, like that, to answer to this question, this misconception that we are maybe not approachable, or people can find some difficulties because they think we are not going to answer. Just to show this is not like that. We are completely open. If someone is committed and motivated, EANS is an open society. And I have not seen any committed person who has not rise in the society today.
May I just iterate one point? One thing that also people have to understand, that to gain a certain kind of reputation in the professional society, you actually have to think in long terms. It's not something which will happen immediately, but it's sort of like building from small blocks over the period of time, getting to know people, getting sort of, as Claudius mentioned, you have to introduce yourself, you have to make, or let's say you have to present yourself as knowing a particular field or whatever, and that also helps you forward. So you have to be enthusiastic, but at the same time you have to sort of understand that it's a gradual process.
Yes, of course. Yeah. And Valentini is remembering us through the chat that for the sections, now there is an open process for the panels. So it's not anymore elective positions. There is an application where you can apply to the section you think you can provide something or you can get in because it is your expertise field. Radek, sorry.
Yeah, that's I saw the point of Valentini, but it's actually quite a new thing, and I'm sure that Claudius and someone else here has more information about the change in the bylaws. But it remains to see how it will work in practice. Just not to be misunderstood. I mean, traditionally, it's been a kind of privilege of a section chair to choose his collaborators, because after all, we need some work to be done. So you cannot just get a bunch of people you don't know. You need some people you rely on. You have to be, of course, a little bit political, choose people from different countries, as I mentioned. But I don't think it's an idea to have like randomly picked up people by some kind of process that you simply apply and will be admitted to the section panel. The section panel is limited to 15 people. You know, the only the first change, which I think is actually very good, is that you are not supposed to sitting there forever just because you're friend with a section chair and you know each other. So now it's limited to 8 years for maximum, or 10 years if you've been a chair. That's a good thing. But I think the process, how actually you will become a panel member is has to be discussed, because after all, you have to have some merits, you know, because how to work in a team on this level. So I'm not aware that it's like finished discussed at the EANS level yet, and personally I haven't understood it correctly how it's supposed to work. So, but it's nothing, you know, in a way to apply or to show your interest, to be more active. And if the chair is like a good chair, he or she actually should be aware of you and use you in the activities of the section, of course.
No, but Radek, if I understood well, and Martin or Andreas can correct me because they are in the board as well, the fact that we have applications is not, that doesn't mean that you apply and then you are in.
Yeah.
It means that there is a formal way to express your interest, and then the chair will review, which facilitates the connection between members and the new chair. If they don't have a direct connection, if they don't have a way to connect to the chair, now there is an open process. You can apply, and then the chair sees your curriculum, what you have done, and decides if you can fit it or not. So it's not that you apply and you are in, but at least it gets an opportunity to the people who are more shy or have the thought that they don't know anyone there, then how I'm going to present to someone in the corridor. Then it's a formal open process. Let's put it that way. But it's not that you apply and you are in. No. I understood that. No, Andreas? And
great. So just to make a point, you know.
I guess one extra small point to make is that there's no perfect way. This is a process in evolution. I mean, many years ago, the panels were at the complete discretion of the chair, and to some extent that's still a valid way of working. And they had a random number of places. Now we try to homogenize things by having up to 15, because we need to have some sort of control on the number of people. We then move to having a limit on how many from the same geographical region or country. We have increased the number of sections, the number of committees, and we have introduced some limit to how many of these committees or panels a single person can be a part of, so that it allows more people to get involved. And what I'm saying, I guess, is that this will change again and again and again. It's always subject to feedback. So it's always good that people from the individual membership write in and they express their views. We always try to take everything into account, and you know, it's a process in evolution.
Yeah, I agree. The goal is to be more inclusive without losing any point in quality. Let's put it that way. And we are on the good way, I think.
I would say perfect way. And also another point, especially in a young neurosurgeon standpoint, I think that our take-home message should be that the time that we can spend being involved in the EANS should be valued as much as possible and not underestimated, because it can be truly a nice opportunity for shaping our professional growth. And I mean, I can make you a personal example, because being involved in the EANS and the networking that the EANS has provided me led me to choose a fantastic place where I'm doing a fellowship. So, I mean, that's of course, every one of us has to put a lot of efforts, but then it's also, you know, personal investment on our, you know, long-term growth, as it was for me. And as far as I get, also for all the speakers. So should be, I mean, at least for me, it's a key point and should be valued.
Absolutely. Actually, I was going to post to make another question for Fabio, Vicky, Catherine, in the way that how has being part of the EANS think that have helped your career progression. I think that's a good point, and there are a lot of people who probably will need to know this.
Yeah, well, I think somehow I've already answered. And yeah, for sure, it's an hot topic, especially as I said, for young neurosurgeons, but also for less young ones that wants to expand somehow their knowledge, or they want to change their routine, or whatever, they want to be involved in a different, environment. And I think the ENS, as it was for me, that's the perfect setting and provided me all the resources for doing that. So absolutely, it's a hot topic. And I'll take the wave of Catherine and Vicky. So I'm looking forward to discuss this topic also in person in Catania. In Italy, it will be a pleasure, but also, of course, in Vienna with whoever, of course. So feel free to ask, to send emails and whatsoever. The ENS, it's a really, a perfect place for doing that.
Vicky, Catherine,
yeah,
what's your thoughts?
Oh, sorry. I think that from what I said, highlighting your work and then also getting to teach and hopefully inspire the younger generations, what greater honor than that would there exist? So that, and also to form collaborations for the benefit of our patients. So those two things I think are really important, and I get to be a part of that. That's a great thing for everyone, for their career. Or
I think what's also very important is to see how people do it differently. I mean, especially in the training courses, you see how it's done in different countries. And I don't know how it's in your country, but in our country, for example, you don't do much of rotations through different hospitals. And I think it's really important to see that there's not only one way, there are different options, there are different techniques. And that's something that EANS can provide, because it shows different types of surgical treatment, of philosophies. And I think that's very open-minded, because you see that there are many ways how to do it correctly, and you can learn from each other. So I think that's a very much benefit of the EANS as well, that shouldn't be forgotten.
Yeah, I absolutely agree. Yeah. Well, guys, I think that we're running out of time. And there are a lot of questions that we could make, because this is super interesting topic, and I think maybe we should organize another session like this one, because it's it's been great what the information that people can get out from this hour that we have been talking about this topic. But we run out of time, and I think we should need to close the session. So I would like to thank you all for being here with us and being part of it, and I will thank to all the assistants to be here. And Marcus, if you want,
maybe just something before you say the
Sure.
final words. I expect everybody to come to Vienna,
Of course.
October 2025. So spread the word. Everybody who is on the call or listening now, I expect you all to be there, and we'll have a good time and hopefully a great Congress. Thank you.
Thanks, Claudius, and thanks, Rebecca. Yeah, thank you all for joining us today. So I think we've covered a lot of key insights on the leadership, the training, research, and how to engage in the EANS. So we hope you feel inspired and get involved. So there's low threshold to contact anybody here. And if there are any questions that are not answered today, so just send them to us and we will answer you by email, so no problem. Maybe Marisa, you want to say a few words and then we close everything?
I'm super happy that we celebrate this webinar for our members. And I just wanted to summarize it because I took some notes during the webinar because it was inspiring also for me. So I will stay with the words from everyone. I will summarize like Claudius said, it requires commitment, but it worth it. And Radek said something very important, that all the section chairs say, oh, if you're interested, just contact me. They are open to offer and to motivate and to help and orientate everyone who wanna get involved in some way. And Martin Lejeka said, we have delegates, we have teachers, faculties proposed by the sections. We have experts. So if you are interested in teaching and you can prepare yourself in some particular field and you want to teach, this is your place. The courses is your place. Catherine said there are a lot of opportunities. And Andrea says something very important. The society is suffering a continued evolution, always in the good way. So we are trying to offer more benefits, more opportunities, and to become better and better, no? And Vicky and Fabio gave the insight for the young ones. These people who finish the training courses and want to continue should approach the young surgeons committee, definitely. But I think the best summary of all is that at the end, everyone has his own pathway, right? So Claudius didn't even go to the training courses, and thereafter was the chair, and Radek started in the training courses. That shows that everyone can find his pathway, her pathway in the society if really is motivated, committed, and talented, or makes the effort to focus on the goal. And that's what we wish for all of you. And we are open to receive emails or whatever from any member. And the most important thing that Claudio already said, and with Fabio, we will be in Sicily and we will be in Vienna. So join us, and you can always be part of the society, because the society is all the members at the end and nothing else. Thank you to all the speakers and the roundtable and the assistant attendees, of course, for joining today. I think it's a good milestone for this committee. Thank you very much. And I'm sorry that I'm sick. Thank you. Have a good
Join
evening.
us in Catania. Thank you so
Yes.
much.
Thank you. Thank you.
Thank you very much.
Thank you also to the
everyone.
office and Valentini for joining.